Somewhere in May last year, when the second wave of pandemic was in full swing, India was struggling to vaccinate its people. The government and the vaccine makers were trading charges while COVID-19 was taking a heavy toll on human lives. India, which was home to the world's largest producer of COVID-19 vaccine, failed to inoculate the entire population during the course of that lethal wave. But a few months on, by the month of July, India became the only country after China to administer over 2 billion COVID vaccination doses. The vaccination drive on scale was hailed as one of the best in the world. So far, over 98% of adults have received at least one dose of the COVID vaccine, while 90% have been fully vaccinated. Nearly 22.7 million doses are available with states as of October 1. And just about 15 months later, by the end of September, over 100 million doses of vaccines ended up being wasted as their shelf life expired. Were there no takers of these booster doses, or they simply didn't reach the needy? The loss, pegged at 2,250 crore rupees, fades in front of the loss it may have cost to people's health as the world is still facing acute vaccine inequality. The shelf life of Covishield is currently 9 months, while that of Covaxin is 12 months. The shelf lives of both the vaccines were extended by 3 months last year. Non-COVID vaccines typically have a shelf life of 3 years. As the pandemic waned, people became complacent. Masks disappeared from public places, and there were few takers for booster doses. Over 84% of India's population is eligible for booster dose, but only 27% of them have received the shot. The booster coverage improved thanks to a 75-day free booster dose campaign by the centre. In mid-July, the booster dose coverage was at meager 8%. Despite the gains, India still has a long way to go in improving booster coverage. Had it not been the free booster dose campaign, the wastage would have been higher. In an interaction with Business Standard earlier, Adar Poonawala indicated that he was trying to save around 50 to 100 million doses of vaccines in a free booster dose drive. Some amount of vaccine wastage is inevitable with such a large vaccination drive. However, governments try to minimize the damage. For all vaccines, GAVI recommends countries to keep the maximum wastage of 25% for the first year, with gradual reduction to 15% by the third year. For COVID vaccines, GAVI assumed the wastage rate could be 10%. If we look at the global scenario, the number of COVID-19 vaccines which are likely to have been wasted since the global rollout began is estimated to be 1.1 billion as of mid-July, according to data analytics firm Airfinity. The other major reason why so many doses ended up being wasted in India was because of misanticipation of demand. Experts say companies were unclear about the purchase orders from the center and ramped up capacity in a big way. Serum had accumulated 250 million doses of formulated vaccines and another 250 million in the bulk form by December last year and stopped Covishield production. Bharat Biotech too had a stock of 50 million doses lying at its plants around April and had halted production of Covaxin. The restrictions on exports did not help either. As India grappled with a deadly second wave in April last year, the government halted vaccine exports and resumed only towards the later end of the year. The restrictions meant that vaccine makers might have missed out on some of the export orders. Professor Y.K. Gupta, member of the National Expert Group on Vaccine Administration for COVID-19, tells more.
As on date, the vaccine which has been given in India is nearly 218 crore vaccination, which is perhaps the largest number of vaccines which has been given across the world. And if you just see, even if 100 million, 101, 100 million means 10 crore vials have expired, I would say this should not be a panic. The reason are this is an unpredictable COVID situation. It's not like other diseases where there's more predictability. I would say that this is not a very happy situation that there's so much of vaccine go waste, but this is not a very alarmingly unusual situation. I would not consider this as a lack of policy planning, but I would consider that this is an inherent unpredictability in COVID-19 type of in the epidemic and the 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 situation, changing situation, and day by day, and the export potential also depends on how fast changing scenario is. So I will not say that there could be better administrative or better planning, which could have avoided completely such type of uncertain situation.
Even though some wastage was inevitable in such a large vaccination drive, the scale could have been minimized through proper planning. But it is easier said than done given the unpredictability of the pandemic.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.